Have you ever wondered if you're following important penis care rules every older man should know? It's a topic that for many men tends to fade into the background as the years go by. We talk about heart health, joint health, brain health, all incredibly important, of course, but the conversation around penis health often stops after a certain age. But here's the truth. The way you care for this very personal part of your body matters just as much now, perhaps even more than it did when you were younger. As our bodies change, our care routines need to adapt too, and that includes how we look after our sexual health and hygiene. In this video, we're going to walk through 5 essential penis care rules that every older man should consider incorporating into his daily life. Think of this as a straightforward, no-nonsense guide. These aren't gimmicks, fleeting trends, or embarrassing fads you might see online. Instead, these are simple, proven practices grounded in medical understanding. They are designed to support crucial aspects like hygiene, promote healthy blood flow, ensure comfort, and maintain long-term function. By adopting these habits, you can stay healthy, feel more confident, and remain in control of your body as the years go on. Stay with me until the end, because this isn't just about a list of what to do. We're going to delve into the why each of these rules is so important for your well-being. You'll also learn about what can happen if these aspects of care are overlooked, and how a few quiet, consistent changes each day can protect more than just your physical health. These practices can significantly improve how you feel about yourself, enhance your relationships, and ultimately boost your overall quality of life. And if you've ever noticed changes down there and weren't quite sure what to make of them, or perhaps felt a bit hesitant to ask, this might be the video that gives you the answers and the reassurance you've been looking for. Let's get started. One of the most fundamental yet incredibly important things any man, especially as he gets older, can do for his penis health is to maintain proper hygiene. This means keeping the area clean, and this is a crucial but, not in a way that strips away the natural protective oils or disrupts the delicate balance of the skin. We're aiming for clean and healthy, not sterile and irritated. Proper hygiene in this sensitive area doesn't mean you need to be aggressive or use harsh products. In fact, that can often do more harm than good. So, what does gentle truly mean when we're talking about penis care? It means using lukewarm or warm water, not hot water, which can be drying and irritating. It means using a soft touch, perhaps with your hands or a very soft cloth, rather than vigorous scrubbing. Think of it as caring for a sensitive part of your body, because that's exactly what it is. The skin here is thinner and more delicate than, say, the skin on your elbows or knees, and it deserves a gentler approach to keep it healthy and comfortable. Many common soaps, especially those with strong fragrances, dyes, or harsh detergents like sulfates, can be problematic. These ingredients can strip the skin of its natural moisture barrier, leading to dryness, itching, redness, and even microscopic cracks that can become entry points for bacteria or yeast. Overcleaning or using products that are too aggressive can disrupt the natural microbiome of the skin, potentially leading to irritation or an increased susceptibility to infections. Your body has its own ways of maintaining balance, and our job is to support that, not fight it. Often, warm water and a soft touch are all you really need for effective daily cleansing. The water itself does a good job of rinsing away sweat, dead skin cells, and any other residues that might accumulate. If you feel the need to use a cleanser, and many men do prefer to, the key is to choose wisely. Opt for a very mild, unscented soap or a pH-balanced cleanser specifically designed for sensitive skin. Look for products free of alcohol, harsh chemicals, and strong perfumes, as these are common culprits for irritation. When selecting a soap, read the ingredient list. Terms like hypoallergenic, fragrance-free, and for sensitive skin can be good indicators, but it's always best to check for common irritants. Remember, the goal is to clean without causing dryness or disrupting the skin's natural protective barrier. A small amount of the right product is usually sufficient. You don't need a lot of lather to achieve good hygiene. It's more about the gentle mechanical action of washing and thorough rinsing. For uncircumcised men, gentle retraction of the foreskin is a key part of the cleaning process. This allows you to wash the glands, the head of the penis, and the inner surface of the foreskin, where a substance called smegma can accumulate. Smegma is a natural buildup of dead skin cells and oils. And while normal, if it's not regularly washed away, it can lead to odor, irritation, and potentially provide a breeding ground for bacteria, increasing the risk of infections like balanitis, which is an inflammation of the glands. Even if you are circumcised, gentle daily washing of the entire genital area, including the penis and scrotum, is still very important. While you don't have a foreskin to retract, the principles of using warm water, a mild cleanser, if any, and a soft touch still apply. Sweat and bacteria can accumulate on any skin surface, so ensuring the area is cleaned gently each day helps maintain overall hygiene and prevent skin issues or odor from developing. After washing, rinsing thoroughly is paramount. Soap residue left on the skin can be a significant source of irritation and dryness, defeating the purpose of your careful cleansing. Make sure all traces of any cleanser are completely rinsed away with warm water. This simple step is often overlooked but can make a big difference in preventing post-shower itchiness or discomfort in this sensitive region. Once you've rinsed thoroughly, the next step is drying properly. Instead of vigorously rubbing the area with a towel, which can cause friction and irritation on sensitive skin, gently pat the area dry with a clean, soft towel. Ensure the area is completely dry, especially in skin folds or for uncircumcised men after returning the foreskin to its natural position. Lingering moisture can create a damp environment that encourages fungal growth like jock itch. Making this gentle cleansing routine a consistent daily habit, perhaps as part of your morning or evening shower, is key. It's not about an occasional deep clean, it's about regular, gentle maintenance. This simple act contributes significantly not just to penile health by preventing infections and irritation, but also to your overall comfort and confidence. It's a small investment of time for a significant return in well-being. Beyond cleaning, one of the most proactive steps you can take for your penile health is incorporating a quick daily visual check. This might sound a bit clinical, but think of it as a brief self-exam, a personal health screening that takes just a few seconds each day. This simple habit can be incredibly powerful in catching early signs of irritation, infections, rashes, or even more serious conditions like skin cancers or sexually transmitted infections, often when they are most treatable. For some men, the idea of closely examining their penis might feel a bit awkward or unnecessary, especially if everything feels fine. However, many health conditions, particularly in their early stages, don't always cause immediate discomfort or obvious symptoms. By familiarizing yourself with what's normal you'll be much better equipped to notice subtle changes that might otherwise go undetected until they become more problematic. Frame it not as vanity, but as responsible health stewardship. So, what exactly should you be looking for during this daily check? Start with the skin. Notice its overall color and texture. Are there any new spots, moles, or changes in existing moles? Look for any areas of redness, discoloration, paler or darker patches, or unusual texture like rough patches or scaliness. Changes in the skin can be early indicators of anything from a simple fungal infection to, in rare cases, more serious dermatological conditions. Next, scan for any rashes, bumps, blisters, sores, ulcers, or wart-like growths. These could appear on the shaft, the glands under the foreskin if you're uncircumcised, or even on the scrotum. Some might be itchy or tender, while others might not cause any sensation at all. It's important to note their appearance, size, and whether they seem to be changing over time. Don't dismiss a small, painless bump as nothing. It's always better to be aware. Also, pay attention to any unusual discharge from the urethra, the opening at the tip of the penis that isn't urine or semen. Note its color, consistency, and whether it's accompanied by any pain or burning during urination. Swelling of the penis or scrotum, or any new areas of tenderness or pain that weren't there before, are also important observations to make. These symptoms warrant attention because they can signal infection or inflammation. While performing your visual check, also be mindful of any changes in the shape or curvature of your penis, especially during an erection if you happen to notice. Conditions like Peyronie's disease, which involves the development of fibrous scar tissue inside the penis, can cause a noticeable bend or indentation and sometimes pain. Early detection and consultation with a doctor can be beneficial in managing such conditions. The best time to do this quick visual inspection is often when you're undressed, perhaps after a shower while you're drying off, or when you're getting dressed in the morning. Good lighting is helpful. It doesn't need to be a lengthy, involved process. Literally 15 to 30 seconds of mindful observation is usually enough once you get into the habit. The key is consistency, making it a regular part of your daily routine. The real power of this daily check comes from establishing a baseline, knowing what your normal looks like. Everyone is different, and what's typical for one man might not be for another. By regularly observing the area, you become intimately familiar with your own anatomy. This familiarity is what allows you to quickly spot when something is different, even if the change is subtle. If you do happen to notice something new, unusual, or concerning during your daily check, the most important thing is not to panic, but also not to ignore it. Schedule an appointment with your doctor or a urologist to have it evaluated. Many common issues are easily treatable, especially when caught early. Trying to self-diagnose or waiting for it to go away on its own can sometimes lead to complications or delayed treatment for more serious conditions. Ultimately, incorporating a daily visual check empowers you. It puts you in a proactive position regarding your health, rather than a reactive one. Early detection of any health issue almost invariably leads to better outcomes, simpler treatments, and greater peace of mind. This small daily habit is a significant investment in your long-term health and well-being, giving you an invaluable early warning system. Chapter 3. Rule number 3. Moisturize for resilience, protecting aging skin. As we age, our skin undergoes natural changes. It tends to produce less oil, lose some of its elasticity, and become thinner. This isn't just true for the skin on our face or hands, it applies to the skin all over our body, including the sensitive skin of the penis. Daily moisturizing, a step often overlooked by men for this area, can play a crucial role in maintaining skin health, preventing discomfort, and protecting this delicate tissue as the years go by. The skin on the penis, particularly the glands and foreskin, is naturally thinner and more sensitive than skin on many other parts of the body. It also has fewer oil glands compared to, say, your scalp or face. This means it's inherently more prone to dryness and irritation, especially as the body's natural oil production declines with age. Think of it like any other area of skin that might get dry and chapped. Your lips in winter, for example, it needs a bit of extra care. Our skin produces natural oils, collectively known as sebum, which form a protective barrier. This barrier helps to lock in moisture, keep the skin supple, and protect it from external irritants and pathogens. As we get older, the sebaceous glands become less active, and this natural protective layer can diminish. This reduction in natural lubrication is a key reason why older skin, including genital skin, can become more susceptible to dryness. When the skin in this area becomes too dry, it can lead to a cascade of uncomfortable issues. You might experience itching, which can be quite persistent and distressing. The skin can become flaky, red and irritated. In more severe cases, dryness can lead to cracking or fissures in the skin. These small breaks, even if microscopic, not only cause discomfort but also compromise the skin's barrier function, making it easier for bacteria or fungi to enter and cause infections. This is where daily moisturizing comes in as a preventative and supportive measure. Regularly applying a suitable moisturizer helps to replenish lost moisture, support the skin's natural barrier, and keep the tissue supple and resilient. This can significantly reduce the chances of experiencing cracking, flaking, itching, and general discomfort. It's about maintaining the integrity of the skin so it can effectively do its job of protecting you. Choosing the right moisturizer is absolutely key. You don't want to use just any body lotion, especially those with fragrances, dyes, or complex chemical cocktails, as these can cause irritation on sensitive genital skin. Look for a simple, unscented, hypoallergenic lotion or cream. Products designed for sensitive skin, or even some natural, single-ingredient moisturizers like pure shea butter or coconut oil, if you're not allergic, in very small amounts can be suitable. Always do a patch test on a small area of skin elsewhere first if trying something new. In some cases, especially if the skin is very dry, prone to irritation, or if you have a condition like lichen sclerosus, which a doctor would diagnose, a medical-grade barrier cream or emollient might be recommended. These are often thicker and provide more intensive moisturization and protection. If you're unsure what product is best for your specific needs, or if you have persistent dryness despite using a gentle moisturizer, it's always a good idea to consult your doctor or a dermatologist. Application is straightforward. After your daily shower, once you've gently patted the area dry, take a small amount. Pea-sized is often enough of your chosen moisturizer. Gently apply it to the skin of the penis, including the shaft, and if you're uncircumcised and the foreskin tends to get dry, you can apply it there as well. Avoid getting excessive amounts inside the urethra. The warmth of your skin will help it absorb. Like any good skincare habit, consistency is what yields the best results. Making moisturizing a quick, regular part of your post-shower routine will help maintain the skin's hydration levels day after day. It doesn't need to be a complicated or time-consuming process. Just a few moments of care can make a significant difference in your comfort and skin health. Beyond just preventing discomfort, keeping the skin of your penis healthy and well moisturized contributes to your overall sexual health and confidence. Healthy, supple skin is more resilient and less prone to injury or irritation during sexual activity. Feeling comfortable in your own skin, quite literally, can also have a positive impact on your self-esteem and intimacy. It's a simple step with far-reaching benefits for your well-being. Chapter 4. Rule number 4. Move for flow, circulation, and your vitality. We all know that good circulation is vital for our overall health. Our blood is the transport system for oxygen and nutrients to every cell in our body, and it carries away waste products. This is just as true for penile health as it is for heart health or brain function. Making time each day for some form of light movement is a powerful way to support healthy blood flow throughout your body, including to the pelvic region, which is critical for erection quality, sensation, and tissue health. As we age, various factors can start to impact our circulatory system. Arteries may become less flexible, blood pressure might creep up, and a more sedentary lifestyle can lead to sluggish circulation. These changes aren't inevitable for everyone, and lifestyle choices play a huge role. Specifically, for penile health, reduced blood flow can have direct and noticeable consequences, as healthy erections are fundamentally dependent on robust blood flow into the erectile tissues. The connection between circulation and erectile function is direct and physiological. An erection occurs when blood rushes into the corpora cavernosa, the sponge-like chambers within the penis, causing them to expand and stiffen. If the blood vessels leading to and within the penis are narrowed, or if overall circulation is impaired, achieving and maintaining a firm erection can become more challenging. Therefore, anything that supports cardiovascular health and blood flow is beneficial for erectile health. But it's not just about erections. Good circulation is also essential for normal sensation in the penis. The nerves responsible for transmitting sensations of touch, pleasure, and temperature rely on a healthy blood supply to function optimally. Impaired blood flow can, over time, lead to reduced sensitivity, which can impact sexual satisfaction and overall experience. Keeping the blood flowing well helps keep those nerve endings healthy and responsive. Furthermore, adequate blood flow is crucial for the health and healing capacity of all tissues, including those of the penis. If there's an injury, irritation, or infection, good circulation brings the necessary immune cells, oxygen, and nutrients to the area to promote healing and fight off pathogens. Sluggish circulation can mean slower recovery times and a greater susceptibility to lingering issues. So, healthy blood flow supports the penis's ability to repair and maintain itself. When we talk about light movement, we're not necessarily talking about running marathons or intense gym sessions unless that's something you already enjoy. The good news is that even gentle, consistent activity can make a difference. Think about activities like a brisk walk each day, some light stretching or yoga, spending time gardening, or even choosing stairs over the elevator. These activities get your heart rate up a bit and encourage blood to move more efficiently through your system. The cumulative effect of small bouts of daily activity can be quite significant. You don't need to dedicate hours at a time. Maybe it's a 20 to 30-minute walk in the morning, or a few 10-minute movement breaks throughout your day. The key is consistency and finding activities you enjoy enough to stick with. This gentle, regular movement helps maintain the flexibility of your blood vessels and supports overall cardiovascular tone. It's important to emphasize that the goal here is sustainable, enjoyable movement, not strenuous exertion that feels like a chore. For older men, activities that are low impact on the joints, like swimming or cycling, can also be excellent choices. The focus is on creating that gentle boost to your circulatory system, particularly to the lower body and pelvic area, on a regular basis. Of course, daily movement is just one piece of the puzzle for healthy circulation. Other lifestyle factors play a significant role too. A heart-healthy diet, rich in fruits, vegetables, and whole grains, and low in processed foods and unhealthy fats is crucial. Staying well hydrated helps maintain blood volume, and critically avoiding smoking is one of the most important things you can do, as smoking severely damages blood vessels and impairs circulation throughout the body. The broader benefits of incorporating daily movement are numerous and well documented, extending far beyond just penile health. Regular physical activity helps manage weight, improves mood, boosts energy levels, strengthens bones and muscles, and significantly reduces the risk of chronic diseases like heart disease, diabetes, and some cancers. All of these benefits contribute to a higher quality of life and in turn support your sexual well-being and vitality as you age. Chapter 5. Rule number 5. Mindful urination. The importance of emptying completely. Our urinary health is intricately connected to our overall well-being, and for men it has direct implications for prostate health and, by extension, can impact comfort and function related to the penis. One often overlooked aspect of urinary care, especially as men get older, is the importance of mindful urination and ensuring the bladder empties as completely as possible each time. This simple practice can help prevent a range of uncomfortable and potentially serious issues. It's quite common for men to experience changes in their urinary patterns as they age. Conditions like benign prostatic hyperplasia, BPH, or an enlarged prostate can cause symptoms like a weaker urine stream, difficulty starting urination, dribbling after urination, or a feeling of incomplete bladder empty. While these changes can be a normal part of aging for many, it doesn't mean they should be ignored or that we can't take steps to manage them effectively. The problem with incomplete bladder emptying is that the residual urine left behind can become a breeding ground for bacteria. Think of it like stagnant water. It's not an ideal situation. This significantly increases the risk of developing urinary tract infections, UTIs, which can cause symptoms like burning during urination, frequent urination, urgency, and even blood in the urine. UTIs can be particularly bothersome and recurrent if the bladder isn't emptying well. Beyond the risk of infection, consistently leaving urine in the bladder can put undue pressure on the bladder walls and potentially exacerbate symptoms related to an enlarged prostate. The bladder might have to work harder to expel urine against the resistance of an enlarged prostate, and if it's not emptying fully, the cycle of frequent urination and discomfort can worsen. Over time, this can contribute to bladder muscle fatigue or overactivity. In the long term, chronic incomplete bladder emptying and the associated issues like recurrent UTIs or sustained pressure can potentially lead to more significant bladder damage or dysfunction. The bladder can lose its elasticity or its ability to contract effectively, making the problem even harder to manage. That's why focusing on techniques to promote complete emptying is a valuable preventative strategy. This brings us to the concept of mindful urination. It simply means not rushing the process. When you feel the urge to urinate, take your time. Go to the bathroom, relax, and allow your body the time it needs to empty the bladder fully. Rushing can lead to tensing muscles that should be relaxed, hindering the flow and contributing to incomplete voiding. This is especially important if you already experience a slower stream. For many older men, an incredibly helpful tip is to try sitting down to urinate rather than standing. While standing is traditional for men, sitting can allow for better relaxation of the pelvic floor muscles and the muscles around the bladder. This relaxation can make it easier for the bladder to contract efficiently and empty more completely, especially if there's any prostate enlargement or urethral resistance. It might feel different at first, but many men find it makes a noticeable difference. There are also specific techniques you can try to encourage more complete emptying. One is double voiding. This involves urinating as much as you can, then waiting for 20 to 30 seconds, relaxing, and then trying to urinate again. You might be surprised that more urine is released. Another technique involves ensuring your pelvic floor muscles are relaxed. Consciously think about letting go of any tension in that area. Avoid straining, as this can be counterproductive. If you consistently experience symptoms like a weak stream, difficulty starting or stopping, a sensation of incomplete emptying, frequent nighttime urination, or any pain or discomfort, It's very important not to just dismiss these as an inevitable part of getting old. These symptoms warrant a conversation with your doctor. They can help determine the cause and discuss appropriate management strategies, which might range from lifestyle changes to medication or other treatments. Taking these simple steps, being mindful, taking your time, considering sitting and practicing techniques like double voiding, can significantly improve your bladder health. This in turn reduces the risk of UTIs, lessens pressure on the prostate, minimizes discomfort, and helps protect your bladder function for the long term. It's another quiet daily practice that contributes significantly to your overall health and quality of life. So, there you have it, 5 essential penis care rules that every older man should consider. From gentle daily cleaning and performing those quick visual checks to moisturizing, supporting circulation through movement, and practicing mindful urination, each of these steps plays a vital role in maintaining not just your penile health, but your overall well-being, confidence, and quality of life as you age. Remember, these aren't complicated procedures, but rather simple, consistent habits that can make a big difference. It's about taking proactive care of an important part of your body. We'd love to hear from you. Leave a comment below and share one thing you learned today that resonated with you, or perhaps a tip you plan to incorporate into your daily routine. Your experiences and insights are valuable to our community, so please don't hesitate to share your thoughts or any questions you might still have. Your engagement helps us all learn and grow together on this journey towards better health. If you found this video informative and helpful, please take a moment to hit that like button. Subscribe to Vexa for more content like this, and consider sharing it with other men in your life who might benefit from this information. Your support is incredibly important and allows us to continue creating evidence-based, practical content designed to inform, empower, and inspire you to take control of your health. Thanks so much for watching, and we look forward to seeing you in the next video.